leagues in world football has been called off, it's been cancelled, and the PSG has been given the trophy. So that's the impact that COVID-19 has had, and in Belgium, they're yet to visit, but when you go to Holland, the Dutch, the league has come to an end. There's no winner, there's no loser. The top 4 teams will be playing in Europa League now, and there will not be any relegation. So it's had a very good impact on society, and we're all hoping that the post-COVID-19 situation will not be that bad.
Thank you so much for joining us here at Mkeke House, where we will be getting an update on the COVID-19 situation in the country. My name is Chileshe Kangwa. What would have been characterized by marching by the workforce today is a quiet day, as many in the workforce look at Labor Day and look at the things that will affect it, especially in the wake of the COVID-19. The Minister of Health has been with us from 11:30 and will address the nation right now.
Good afternoon, members of the press and countrymen and women. Good morning. Let me begin by wishing all our workers happy Labor Day. On this unique May Day, we would like, on behalf of government and the President of the Republic of Zambia, His Excellency Dr. Edgar Chagwa Lungu, to appreciate and celebrate all the health workers, the multi-sectoral colleagues who have worked as rapid responders and supporters to the fight against COVID-19. We salute all of you as we commemorate the achievements of the labor movement, even in these trying times. We further acknowledge the support and solidarity from the labor movement as they have continued to donate towards the response, the COVID-19 response. The government of the Republic of Zambia, under the stewardship of His Excellency President Lungu, continues to respond to the COVID-19 outbreak, informed by evidence, informed by emerging issues, and the evolution of the pandemic. Zambia has mounted a multi-sectoral rapid response to COVID-19, and on a daily basis, we are updating you on the outcomes at the front line. In the last 24 hours, 19 patients have been discharged from the isolation facilities under COVID-19. We have recorded 19 recoveries. So 19 patients have been discharged, and this brings the total number of recoveries or discharges to 74. This is a milestone, and would like to appreciate our frontline health workers and their multi-sectoral colleagues for the good outcomes. Out of the 487 tests that were conducted in the last 24 hours, 3 were recorded as positive cases. And these 3 involved a 55-year-old truck driver from Tanzania who entered Zambia through Nakonde on the 26th of April and was quarantined in Ndola. He developed symptoms and presented to Itawa Clinic, where he was swabbed and now has been found to be positive and admitted to Masaiti. The second case involves a 36-year-old man who is a contact to a known case in Lusaka. And the third case is a 13-year-old young girl from Mutendere who has been swabbed at the Levi Mwanawasa Hospital as they came for the routine service delivery, and now they have tested positive. All these 3 are not only admitted to our isolation facilities, but are having all their contacts being traced. We therefore have a total of 109 cases of COVID-19 recorded, with 74 discharges, 74 recoveries, and 3 COVID-related deaths. It is also important to note that out of the 19 patients that have been discharged, 9 are health workers. Therefore, the number of cases that remain active in our facilities is 32, and 25 of these are in Lusaka, while 7 are on the Copper Belt. We have amongst the 32 patients a 3-month-old baby who was admitted through UTH for pneumonia and was swabbed as per protocol. And this 3-month-old baby is the one who is admitted to Levi Mwanawasa Hospital and is the one who is unstable and is surviving on oxygen. And our team of experts, led by Professor Msuku, who is in our audience today and we recognize you, and the other colleagues in the clinical case management team, like Dr. MoH Press, are all working together to ensure that this precious baby is saved. The rest of the 31 patients are stable. Today, our surveillance teams that have been doing mass screening and targeted testing in Lusaka are in Rosspark area, and they are conducting mass screening and targeted testing as they did in Kamwala, Madras, and as they did in Makeni and other areas. This screening will continue to take place because our strategy remains case finding and quarantining these cases, ensuring that we stem community spread and ensure that the other measures are carried out to prevent new infections. At a global level, we have now recorded 3,308,323 cases, including 234,101 deaths. This has also included recoveries at 1,042,874,000 in 210 countries, and 2 conveyances as at 7 o'clock a.m. today, 1st May 2020. In Africa, closer to home here, in the last 24 hours, we've recorded 2,000 new cases, and that brings our tally to 39,785 with 1,638 deaths and 13,078 recoveries in 55 countries and territories. In the SADC region, 9 countries have recorded a total of 6,075 cases with 117 deaths and 2,203 recoveries. Distinguished ladies and gentlemen, members of the press, fellow countrymen and women, Nakonde operation is being enhanced. We have heightened port health services in Nakonde. We have reinforced the team in Nakonde with a technical team from the Zambia National Public Health Institute, and a number of port health staff have been deployed to reinforce surveillance. Furthermore, mass screening and testing has commenced in Nakonde and will be heightened within the next few days. Another key thing that has happened in Nakonde is that we have now identified a bigger place for quarantine. Now, this means that for those of you who will be coming back from Tanzania through Nakonde border, you will be mandatorily quarantined in Nakonde for 14 days before you are admitted into Lusaka or the Copper Belt, or indeed any other destination that you are headed to. That 14-day mandatory quarantine period will involve monitoring you for symptoms and signs, will also involve testing you, and will be discharged as the multi-sectoral clinical teams decide. Therefore, as you make a decision to travel to Nakonde and beyond, be rest assured that you will be quarantined for 14 days before you are admitted back. This is in line with the presidential directive. In his address, His Excellency President Lugu made it categorically clear that non-essential travel must be avoided or postponed. And he also made it clear that quarantine shall be enforced for all those returning home in order for us to reduce importation of cases and hence protect the public from COVID-19. We have further identified another quarantine facility in Impika for mandatory quarantine of other people who will cross through other points and are picked by our surveillance teams in transit. Furthermore, we've now arranged escort teams, and for any cargo carrying truck that is of emergency or urgent nature, they will be escorted to the destination. And after offloading, they will definitely be admitted to quarantine facilities. All these measures are in response to the call by His Excellency President Lungu to ensure we avoid a public health crisis while allowing the economy to run so that we can avert poverty and hunger. That delicate balance is an imperative we cannot escape from. I'd like also to appeal to members of the public on the Copper Belt to ensure that non-essential travel to Lusaka and outside the Copper Belt is avoided, particularly travel to Makonde. Stay home and be safe, and would like to request you further to participate in the surveillance activities that are being heightened in the province in targeted towns to ensure that we can establish the full extent of COVID-19. As we commence the prevalence study in the next few days to weeks, we will again request you to participate in this research study so that we can establish the prevalence of COVID-19 in the country. Members of the press, fellow countrymen and women, as I conclude, let me reiterate our salutation to our healthcare workers, including doctors, nurses, laboratory experts, public health experts and practitioners, pharmacists, our nurses, our physiotherapists, support staff, and their multi-sectoral teams, and other paramedics at the front line who are working to safeguard the health security of our country. Our nation owes you a debt of gratitude as you continue to battle at the front line. Indeed, while the celebrations may be low-key this year, for obvious reasons, I can assure you that the appreciation of the nation and its peoples at the front line isn't. We celebrate our workforce in the country who are instrumental in determining the overall outcome of the COVID-19 response and the dynamism of Zambia's economy under the current difficult circumstances. I reiterate the call from the Republican President, His Excellency Dr. Edgar Chagulungu, for all of us to stay home and be safe, to avoid non-essential travel, heighten cleanliness, ensure physical distancing, and avoid public gatherings unless they are cleared by public health officers as having met the regulations and guidelines and certified so. And let us ensure that we put on masks. Cloth masks are very effective and they are reusable. And if you're using a surgical mask of the nature I am putting on, use it for 6 to 8 hours and dispose of it safely. A cloth mask, wash it on a daily basis. So let us work together to help stop COVID-19, and let us ensure that in solidarity we support the workers. On this May Day, it is important that we reassure them of our appreciation of their patriotism. Participate and cooperate with health authorities in the communities as we heighten surveillance in Lusaka and the rest of the country. And if you're sick, please call 909 on 0974 493 553 or 964 638 726 and 0955 389 8941. If you make a call to these numbers, we will be able to assist you, including transportation. Do not just appear at any hospital. There are facilities that have been designated as COVID treating facilities. So let's make the efforts of the frontline health workers on this May Day worthwhile by heeding the health guidelines as outlined in the Public Health Act, as outlined in the presidential address. I wish you peace, prosperity, health, and wellness, and may God bless Zambia on this unique May Day. I thank you.
And the first question is the Ministry of Health aware that exchanging of used masks is becoming a common feature when people are denied entry into some buildings and buses? Then the second question is there any possibility of televising the distributed, donated items while distributing them to the places that they are supposed to be distributed to, because people are doubting the process? And the last question is, what would it take for the ministry to start the door-to-door screening as opposed to what is happening currently? Thank you.
Good morning, Honorable. My name is Bushman from Diamond TV. My first question is on the two patients on the copper bill. And the public would want to know the maximum period that a patient with a severe COVID-19 can recover. I ask this because the patients on the copper bill, I think, have been there for over a month. And then the other question is on physiotherapy, which is a part of the multidisciplinary healthcare team involved in case management of COVID-19 patients, as can be seen from other countries. The role they play a role in cardiorespiratory physiotherapy, focusing on management of critically ill patients. The public would love to know if we have such people, and if we don't, why. Then maybe just clarity on the 3-month-old baby. You can maybe give us more information on how he or she contracted the virus. Thank you.
Well, thank you very much indeed. The PPEs that have been reportedly, that we hear reports that are being shared, particularly the masks. I'll only take this opportunity to counsel the public that you cannot share a face mask. That is the surest way of transmitting COVID-19 and even other respiratory infections to the next person. So you cannot share a face mask. A face mask is not going to be used by one person and then used by the next person. Even the face masks that you're using, these disposable ones, you cannot even recycle them. You can only wash a cloth mask. For the face, for the surgical mask of this nature, you cannot recycle it. You cannot wash it. You cannot use it again after 6 to 8 hours. So I will use this platform to counsel anybody involved in such practice to stop, and to stop immediately, because that is one way they are going to transmit many pathogens even beyond COVID-19. The next question was on televising of distribution of PPEs, because people mistrust it. Have you ever heard of hypochondriasis, a condition called hypochondriasis? Hypochondriasis is a condition where somebody believes they have a problem when they actually don't. So they'll claim they've got pain in the knee, and they'll come to the hospital, and when you examine and do everything, that pain actually is not there. They're just convinced that they have pain in the abdomen. You check in the abdomen, do everything, you won't find it. You know, so it is this belief that you have a problem when the problem is not there. There is also now what we are calling political hypochondriasis, where people assume there's a problem when there's no problem. So we will urge the political hypochondriacs to join the fight against COVID-19. It's a heavy fight. We need people to come on board in solidarity and in unity of purpose. And maybe some may be projecting their lifestyle of thieving. The health workers and the multi-sectoral teams are people of integrity, and they're taking the war against COVID-19 very seriously. Any slip-ups would result in deaths. So for us, we are not preoccupied with any intention to divert anything from COVID-19 donations. And for those of you who may think that there's a lot of COVID-19 donations, we're not even at 20% of what we need for COVID-19. And like I said, we have put up systems that are for all to see. Government has systems. Government is transparent. There are methodologies of accepting donations. They are entered into donations registers. They are booked out and approved by responsible officers. And wherever they are taken to, they are utilized as per need. What would you want to use a face mask for? We use face masks, by the way, on a daily basis in our theaters, in our outpatient departments. We're not excited about it. And COVID-19 is an infectious disease like many other infectious diseases. And we use face masks on a daily basis, even without outbreaks. So we wonder the excitement, but we do believe that it is the political hypochondriacs who try to divert attention. They will not succeed. We will remain focused on the high priority of saving the nation from the devastating economic effects and public health effects of COVID-19. So I'll reiterate my claim that we will not spend time nor glorify such negative energies with responses all the time. That's why we don't respond to what we hear and see in many different blogs. The conversion from positive to negative may take as long as 8 weeks, so there's no limit as to how long we'll keep you. We'll keep you for as long as you're positive and for as long as you have symptoms. So we will discharge you when you're asymptomatic and you convert from positive to negative. on 2 days consecutively. The child, 3-month-old child, is it in Chimonia, your brother Darius, Chimonia? Yeah, that 3-month-old child, like we've repeatedly said, that we've heightened surveillance in the communities and in our hospitals. The reason is simple. The reason we've heightened surveillance is that there are patients who will present with other symptoms in a facility, but maybe that comorbidity is, or there is co-infection with COVID-19. And as you know, those patients with comorbidities are not responding very well to COVID-19 or are more vulnerable to severe illness and death. So this is the reason why we have stepped up surveillance in our hospitals and other health facilities to ensure we don't leave out any case. Remember, in the communities we have surveillance, at the ports of entry we have surveillance, in transit we have surveillance, we have surveillance which we call health facility-based surveillance. So this child was one of the cases that presented in our hospital, presented with other symptoms, and as part of the routine hospital-based surveillance, we did swab the child and picked out that the child was positive. And so we admitted this child to the COVID treatment facility. But otherwise, the child initially presented with sepsis in the facility, and later on, after swabbing, we found that they had COVID-19, and they actually did develop pneumonia along the process. So our teams of experts are working around the clock to save the life of this precious child. Did I miss any question?
Question on chamber strategy.
On?
There's chamber strategy on the screening mode. Are we going to go the door-to-door screening way, or will be the same way we're doing it?
Well,
And there's also a question on the role of physiotherapy and the treatment of
well, we have said we have commissioned a study, which we're calling a prevalence study. The sample size of the people who test will actually be representative of the population in the country to help us determine the extent of the disease in the country. So we're not necessarily shifting to door-to-door, but we'll do a prevalence study that will be countrywide, and that will help us establish the prevalence of COVID-19 in the nation. Secondly, we are also going to continue our mass screening and targeted testing. Will be informed by evidence. And what is important to note is that testing is fundamental in the response. This is the reason why we are scaling up our laboratory capacity, so that in a day we should be reporting more than 1,000 cases, 1,000 samples, processing more than 1,000 samples in a day. So we will not stop re-emphasizing, we will not stop emphasizing the need for us to ramp up testing as a key measure to bring up one key variable, that is the number of positives, so that we can even use that to determine the extent of the challenge and even inform key direction in terms of the cautious reopening of various parts of our livelihoods that have been negatively affected. So we will ramp up testing. We may not do door-to-door. We may do door-to-door in selected parts of the country. We may do door-to-door as part of surveillance testing in selected parts of the country, but we are not saying all the 17 million plus Zambians will be tested. No, but it will be a selective process, but it will be representative of the population. And so, for that study, you'll be reassured. For the mass screening and the targeted testing, again, we are ensuring that we pick up areas where we will be able to determine reasonably how far the disease has gone into that area population. Physiotherapists are part of the workforce, and physiotherapists are part of the multidisciplinary team that is working, providing health services. There are many more areas we may not have mentioned. There are psychiatrists, there are psychotherapists, there are psychologists. There are many other disciplines. As you know, medicine has a lot of disciplines, and every discipline participates in the multidisciplinary management of cases. Even in COVID-19, we have those physiotherapists.
Thank you so much. Do you have any other questions? You want to do a follow-up? Do you have any others? Okay, so follow-up on
Again from Diamond TV. Honorable, maybe just a follow-up on a 3-month-old baby. You've spoken that he or she may have contracted the virus from the hospital. Have parents been also tested for COVID-19? Because you don't really know where they got this virus.
do you have any other questions?
Well, the parents are part of the contact tracing targets, and so the parents have equally been swabbed, and indeed any other contacts. But we are not saying that at this stage we have evidence that this was hospital acquired. No, we're not saying this is a nosocomial infection. No, what we are saying is that we found this child to be COVID-19 reactive, and what we are doing is instituting an investigation the way we do with others, and we'll keep the nation informed when we establish adequate evidence of epidemiological links.
Thank you so much. I think that point has been made. Do we have any other questions or clarifications? Honorable Minister, since those were the remarks of David President, I call upon you to conclude the panel.
On this May Day, we appreciate the media for your hard work and patriotism to the cause. We appreciate the Zambian worker, the labor movement, for the patriotism in providing service to the Zambian people in these trying moments. We appreciate the health workers, the multi-sectoral teams, and on behalf of His Excellency President Lungu, we salute you for what you're doing at the front line. You are the true heroes and heroines of the war. As we conclude, 19 discharges today, bringing up the case of recoveries to 74. And this is out of a total of 109. We have 32 under admission, all except the 3-month-old baby stable. And please, let's heed the call from the Republican President, His Excellency Dr. Lungu, to stay home, be safe, and ensure that physical distancing when you're out there is implemented. Mask up and escalate levels of hygiene, and ensure you avoid public gatherings. If you do not travel, then the virus has no vessel to move it. If you do not travel, the virus doesn't have a person to get into from that person you're going to visit. Stay home and be safe. The inconvenience is noted. The disruption in our livelihoods is noted. But this is essential for us to stop the epidemic and avert greater suffering in the future. The strategy remains the same. We will ramp up testing, improve surveillance, and ensure we find the cases and put them aside, isolate them, treat them, and ensure there's no person-to-person spread. Your participation is vital. Your personal responsibility, your personal responsibility is key. So let's summon the best of our conduct and in solidarity act together to fight COVID-19. Thank you most sincerely, and we'll see you tomorrow.